Steph, I'm glad you could join us today and talk about your experience with superior canal dehiscence syndrome, which is unique, right? Because you've had surgery on both sides. About 10% of our patients have had bilateral superior canal dehiscence surgery. So tell us about what the hospital stay was like the first time and the second time for you. How'd you prepare for it?
So the first time I really did not know what to expect. I'd never stayed in the hospital before. I'd mostly just had, outpatient procedures, if anything. So I talked to some people to get an idea of what I might need, what I wouldn't need, and I really got split answers. Some people told me, you're going to want to get out of that hospital gown as soon as possible, bring comfy clothes, you're just going to be hanging out all day. Other people told me, you're going to be in a hospital and they're going to be coming and checking on you, taking your vitals. There's really no need to change out of a gown. So I'm an over-preparer, and I packed a huge bag full of comfy clothes and things to do that I never touched.
Really?
Yes. The first surgery, I felt terrible.
Really?
I had a lot of pain from my jaw incision, and so I was just taking painkillers and really not interested in doing anything more than staying in bed. So there was really no point for me to change my clothes. And I was very comfortable as I was. The second time, I learned from my first experience and knew I really didn't need anything other than a change of clothes to wear home and some basic toiletries. So the second time, I brought a very small bag, and I didn't feel like I was missing anything for that second visit. So that was my main concern about what to bring. I was very comfortable with, most other aspects of the hospital stay, so I was just focused on what I was going to need while I was in there. And the hospital also provided a lot of things too, so I really didn't even need to bring toiletries if I didn't want to.
You mentioned you had pain after the first surgery. Did you feel like that was treated adequately and quickly?
Absolutely. So I've been forewarned that there was a chance that I could have some jaw pain, and admittedly,
because we have to cut through the chewing muscle and sew it back together.
Yes. So I will admit, when I heard jaw pain, I was thinking more jaw joint and less jaw muscle, which I've learned is quite a massive muscle.
It's big.
So I knew that there was a chance I might wake up and have jaw pain.
So you had the patient-controlled analgesia device, right, to deliver pain medication?
I did. I think I had that for about 24 hours, and then they weaned me off of that and moved me on to pill form pain management. And I was able to wean off of the pain medication after most of the first week. I think by the end of the first week, I was just using Tylenol as needed. So
Steph, tell me about what it was like for you the morning of surgery. It must be kind of scary.
So when you first get to the hospital, you go through the check-in process, and your loved ones get checked in with a nurse in the waiting area, and then they take you back to the pre-op area, and they take your vital signs and get you all dressed for the surgery, and then you do a lot of waiting until it's time to go. But then you came through to talk to me about what we were doing and see how I was. Your team came through to confirm everything. I was pretty nerve-wracked at that point. I had actually been incredibly calm about the whole thing until it was go time. So at that point, that's when I started to get nervous, just because I knew it was going to happen. But I was wheeled into the operating room, and you were in there, and it was really great comfort to see a friendly face, and to start getting prepped for the surgery.
And I think I told you, you've already done the hard part, making the decision and coming here. Now all you have to do is take a nap.
Yep, just take a nap and let you guys do what you're trying to do.
Okay, so we take the bandages off and we tell you, you can shower. What's that like?
So I opted to wait until I got home to wash my hair. I did shower while I was in the hospital, but I waited to take a full hair washing shower until I got home. And the first time is a little strange. You've got staples and stitches and ointment in your hair. Luckily, you guys wash our hair before we are bandaged up, so there's nothing gross in there. But the first time is definitely strange. I was advised to use baby shampoo so that it didn't cause any further buildup or reactions with the sutures. And as someone who had all those strange auditory symptoms, the first time washing my hair was actually pretty magical, because I couldn't hear my hair as I was washing my head. So that first shampoo is pretty wonderful, but I did wait until I got home. I was allowed to shower in the hospital, but I waited.
We like to have people do it in the hospital, because if you're going to lose your balance or anything, it's good to know about it while you're in the hospital and have help there.
And I did have a family member sit outside of the
Great.
shower so that I had some supervision in case there were problems.
Good. And then you had to start balance therapy,
Mm-hmm.
vestibular physical therapy in the hospital. What was that like?
Both times that I had surgery, one of the vestibular therapists came to the hospital room to work with me. I believe they came each day that I was there, and they gave me some simple exercises that I could do both to gauge how I was going to fare once I went home and also to get me started until I started seeing someone outside of the hospital. They bring a packet of information that you can take home. And then they also take you for a walk around the hospital floor and check on your balance, see how you're doing with that, if you can walk unassisted, and get you to the point where you can walk with some assistance.
What's that first walk like?
The first walk is scary.
Why?
Because you just don't know how you can walk. I didn't have a ton of balance issues before my surgery. Most of my symptoms were auditory and visual related. I had some balance issues with bending over and standing back up, but just general walking around wasn't really an issue for me. So the first surgery, I was just unsteady. It wasn't too terrible. Not that much I felt had changed. But with my second surgery, my balance was much more compromised. So that first walk around.
And we expected that.
We did.
After plugging both superior canals.
Yes, I was prepared for that. So the first walk, I think, after my second surgery was a little bit more nerve-wracking, just because I did need someone to hold on to me when I was walking, and it took more practice for me to be able to get my balance back. So in addition to walking, they also have a little flight of stairs that they have you practice walking on to make sure if you have stairs at home, you'll be safe and be able to do that. But yeah, that first walk is a little scary.
What's it like eating after surgery?
So again, I had two different experiences with eating after surgery. The first time, because of the jaw pain, I was on basically on a soft food diet, mostly things like soups and mashed potatoes and the amazing mango ice that we have.
Mango ice.
Mango ice. It's just mango flavored Italian ice, which is just a nice treat when you're in the hospital eating hospital food.
Patients have told me that they all have the mango ice after superior canal dehiscence surgery.
Yes, this is true. It's got a little bit of a cult following.
Does it feel like a turning point in your recovery?
A little bit, because you get to have a nice treat after something that you just went through, and it makes it something to look forward to.
Do you think are there specific turning points you tell patients about in the recovery?
Yeah, the first couple of days is just kind of a wait and see. I think most people, when they wake up from surgery, they realize right away that a lot of their auditory symptoms have gone away.
Not everybody.
Not everyone, but a lot of people. I know for me personally, when I woke up from each of my surgeries, I found that my auditory symptoms had not returned. So I think there's waking up, there's getting your bandages off, getting out of bed the first time, maybe getting some mango ice. And then when you get to go home, that's when your recovery really starts at that point. The first week, I think a lot of people are concerned about what that's going to look like, and from my personal experience, it was different both times. So you really have to just kind of pay attention to what your body is doing and how it's reacting. My first week with my first surgery, I had that jaw pain, so I was kind of just a bump on a log. My mom came down to visit to help take care of me, and so we just kind of hung out at home and watched movies and just took it one day at a time. With my second surgery, I felt a lot better, so I was able to kind of be a little bit more of an interesting house guest.
You mentioned your mom. Was she or your other family able to stay with you in the hospital?
Yes. So my mom came down after I had gotten out of the hospital. Sorry, right. And my husband came with me. So we actually didn't know the first time that he could stay in the hospital room. So we had booked a hotel for him to stay in across town. And then the night that I was about to stay in the hospital, the nurses let us know that he could stay there as well. So there was a couch that folded out into a bed and also a reclining chair in my room. And they provided linens and bedding and all of that so that he could stay. And I'm very glad that that was an option. I didn't really think about that part of having someone there with me while I was just, kind of sleeping in and out of sleep. But it was really a great comfort to have somebody there with me during that time. And if I needed something, or he needed to go find a nurse for whatever reason, he could do that for me.
You mentioned the bandages coming off, and then of course there's trying to shower and wash your hair the first time, and seeing how much hair we shave, which we try to keep very small. How was that?
I was very glad to have the bandage off. It was on there pretty tight because, brain surgery.
We have to keep blood from developing under the skin for about 48 hours.
That was great to get that off. And so a lot of pressure that had kind of felt around my head was relieved once the bandages came off. And there was just not very much hair that you guys had to take, which was really, really wonderful. And you kind of prepared me for that ahead of time, but I really I could barely find where the staples and stitches were on my head. I had to have my husband kind of pull my hair up and take a picture for me so I could see, because I couldn't find them myself. And then after the staples came out, of course, you couldn't tell at all. My hair is more or less how it was for both of my surgeries, and you couldn't, unless I picked up my hair to show you where I had had surgery, you couldn't tell, which was wonderful.
So how are you doing now? Are you confident you made the right decision to have both the first surgery and the second surgery?
Absolutely. I didn't realize how miserable I was until after I had those surgeries done. I knew that I had made a lot of changes to my life before as I was leading up to the first surgery, kind of reflecting and looking back on what was different in the months leading up to that point. I really had changed my life to accommodate my symptoms. And since I've had both of these surgeries, I'm doing basically pretty much whatever I want to do because I can. I had kind of turned into a hermit beforehand, and because I didn't like to be in loud places, I didn't like to be in crowds. Walking around could hear my footsteps, I just chose to stay home instead of having to deal with those sorts of things. And my home was nice and quiet, and I didn't have to go out into the world and experience the external noises. But since I've had these surgeries, I can really do more or less whatever I want. I do have some, small things that I'm still working on. My balance is still not 100%. If I don't sleep enough, if I let stress get out of control, then I can have a little bit of symptoms now and then. But I've learned how to manage all of that pretty well. So most of the time I say I'm between 90 and 95% operational.
Yeah. As we discussed, we were really hesitant early in the experience with superior canal dehiscence surgery to plug both sides. But it seems like the experience that you've had in other patients is that second side, although it's a longer recovery, has really been worthwhile. Do you find that your balance is a limiting factor in any of your daily activities?
I don't think it's a limiting factor. I think with the vestibular therapy, I've learned, I've kind of had to retrain my body to do some things in terms of, turning my head from side to side or up and down. And I went to vestibular therapy after both of the surgeries. It was a little bit of a longer experience for the second one because my balance was more compromised after the second surgery. But with the training and doing it at home and both in my doctor's office, it's definitely helped me regain my balance, which was not that bad, honestly. It was worse than it was, but it still wasn't all that bad.
So you got the bandages off, you got showered, you're ready with your physical therapy and ready for discharge from the hospital. Or did you feel ready at that point, and what did it feel like going home?
I did feel ready. With my first surgery, I was in the hospital from Friday to Sunday, and my second, I was in from Monday till Thursday. And by the time I was able to be discharged, I'd had visits from you and from the nursing staff to go over, post-op plans and medications and all of that. The vestibular therapist had come and given me homework to do once I went. So I felt like I had a lot of information and a plan for what to do once I got home. My husband was there to kind of hear all of that and help me execute this plan that I'd been given.
Steph, Johns Hopkins is, of course, a teaching hospital, and I've got a team of residents, fellows. There's a big nursing team involved, anesthesia. There's a big group. How was the team as part of your stay?
The team was great. It was great to know that there were other people aside from you, if for some reason you weren't available, who knew my situation, what I just had done, how to treat it, you know, what was going on with me if you couldn't for some reason. And then also I think it's really wonderful that there's a team that you're teaching and you're preparing to be able to treat other people like me in the future.
Yeah, no, it's really important. Thank you. So you've reached out to other patients to be a peer counselor. Tell me what that's like. How's that been for you?
It's been great to be able to connect with other people who have this condition. On the one hand, it's nice to be able to talk to somebody else who knows what you are going through, and you know, you can have those Me Too moments. So on the one hand, it's been nice to be able to, to talk to other people who have this condition, but also to be able to use my own experience to help other people go through something like this. There's so few of us that being able to serve in that capacity, I think, is really helpful and important. It's a scary thing to be told that you have this condition and the way to fix it is with this intensive surgery. A lot of people haven't been in the hospital, I've never had stitches before. So to be able to kind of help people walk through this before they get here, I think it's the least that I can do to help.
Yeah, well, we really appreciate it, and it is a hugely helpful thing for other patients to hear personally what the experience is like, especially when you've had repair on both sides.
Mm-hmm.
So,
I'm glad to do it.
we're appreciative, and we're glad you're back to your life and moving on.
Well, thank you for making that happen.
Thank you.